IMPACCT's all about improving outcomes for palliative care patients, people in aged care and people with chronic diseases. So our research is patient-focused but globally connected.
IMPACCT is making a difference with a really committed, collaborative team across many hospital sites, across universities, medical research institutes, and that spectrum means that we can improve what we do.
IMPACCT is really focused on outcomes that are important for patients and families who are living with chronic and palliative illnesses. So we look at things that patients and families say is important, and that allows them to live well, function well and feel comfortable whilst they're living with those illnesses.
So the academics at IMPACCT have to work very closely with clinicians because they have to work with patients, and to get access to patients is through the clinicians.
Our connections globally are health services around the world in more than 20 countries and more than 100 sites that have signed up with us to collect data on day-to-day practice.
We've brought together a group of highly talented clinical academics to work together with our clinical partners to answer real-world problems associated with end-of-life care, aged care and chronic illnesses.